You are watching the DocTalk show.
So welcome back. We are in the studio with our senior experts in the field of the medicine that deals with heart conditions in children, and are discussing conditions that children are born with that whereby they have defects in the heart, and there are those that they acquire later in their lives. So how can a mother who is breastfeeding the child tell that this child might have a hole in the heart, like that congenital heart problem?
A newborn that say has congenital heart disease, that newborn may have blue discoloration of the lips. The lips may turn blue, or the feet or fingers will turn a bit blue as they breastfeed. That shows they're getting a little more tired, or they breathe with difficulty. They struggle to breathe, and as they breathe with difficulty, they go off the breast. They fail to suckle. Around 6 to 8 weeks, when the mother takes the baby back for immunization, the nurse may pick something. You may find that the weight has not been achieved. Our standard baby is about 3 kilograms, and then maybe by 6 weeks, this baby is still 3 kilograms, or is 3.2 kilos. So it clearly tells you that this baby has not gained weight, and yet we expect them to gain a certain weight in the first 1 month. So already those are key indicators.
Are these heart diseases in children, are they treatable in any way? Like, is there treatment available for these conditions that we talk about?
Depending on when they manifest, okay? Sometimes they come when they need very simple treatment, which may be drugs, but then we have those who need to be operated. Because once we have a child whose heart didn't develop completely, or some sections didn't grow, that one has to be operated so that those sections are made complete. Then we have
like you mean the holes in the heart?
Yes, the holes are like punched.
You can do the surgery to correct.
You do the surgery to close
the hole.
that abnormal hole, and the children will grow.
Actually grow, and you'll never remember that they had a problem.
Okay, yes. and these surgeries are done in the heart.
Yes.
These surgeries are done in
locally
Uganda
by Ugandans.
By us, we are here. Okay?
Yes. So you don't have to send children abroad. Is it going to India? Or
and this is one of the misconceptions. A few years back, many children were going to India and other countries because people thought this treatment is not available in Uganda. As we speak of now, most of the treatment options for most of the diseases of the heart,
85%.
up to 85%, as she says, we are able to manage them at Uganda Heart Institute. I think that is a nice thing, and Ugandans should be happy about
yes,
that.
And that's many Ugandans should be proud of that. That we can be able to do our own heart surgeries within the country.
By our own people.
By Ugandan doctors,
operating in Uganda on Ugandan people.
With good outcomes.
With good outcomes. Yeah, because we rarely see people die. Okay. So for that reason, Ugandans need to know that the surgeries mainly, we are either closing the holes which are within the heart, or we are replacing the parts of the heart that are sick. In this, what do I mean? When children come young and they have some sections of their heart are not complete, so they have the holes, we patch them up, we repair them, okay? Now, as they grow and they get their structures within the heart destroyed, we go ahead and replace them. And this happens usually mainly with the valves, okay? We go either repair them, sometimes you can repair them. They are repairable, or they are beyond repair. So in that case, we go further and we remove all those other incomplete valves, the sick ones, and we put the new ones.
And put brand new
and
valves.
These children will grow up to, but however, you guys have to know that these surgeries are done at different ages. Okay, we don't do everything at every age, but those details can be received when you visit the heart center.
But the good news is that the surgeries are available within the Heart Institute.
Yeah.
Okay. So how about these medical the treatments?
So
are they also available in all the hospitals, or it is only in one place?
So medical treatment is actually much more easier. So depending on what the problem is, one, there are those that we use to actually close certain holes, certain defects, especially in the newborns. Remember, we talked about a ductus arteriosus, a patent ductus arteriosus, certain hole in premature babies. So that you can actually hold it if you get these children, say in the first 10 days of their lives. You can give some drugs to prevent that from occurring or being carried on to adulthood. Two, we have a catheterization lab at the Uganda Heart Institute. So we have a theater where they actually do the cutting, and then we have the catheterization lab where you can actually operate without cutting, without a scar. And as we speak, this has been going on over time. So they don't have to cut, but they pass certain wires through blood vessels, get into the heart, and then you can patch that hole. So you can put a device in the heart to close a defect or to close a PDA. And the outcomes are very good. So yeah, so the hospital stay is just 2 days. The day you're admitted, then the next day you're worked on, and day 3 you're going home with no scar, without anything. And this is done perfectly well with very good outcomes. So, and then for those, there are those that are not amenable to surgery, that are a little difficult, the 15%. So those are palliation patients that we follow up. We may put them on some drugs, but you're better off managed in the Heart Institute than elsewhere. Because palliation is, you're not necessarily curing, but you're
hoping to relieve
improving the quality of
the
life.
quality.
Those in heart failure, you manage, okay? Because there are those some acquired heart diseases that actually do not give you an allowance to operate the heart. For instance, if the heart is big and is not squeezing well, you cannot do anything to that heart, whether in the US, you're not going to operate the heart. You either replace the heart or you give a device to help in contracting, which is a little complex. So those ones, we keep them on medical treatment to prevent the heart failure.
So I'm wondering, for the child, the mother who is like in Karamoja, what wouldn't it be too much for them to travel there from Karamoja all the way to Kampala to do these medical follow-ups? Are there systems where you can follow them up even in the community?
The challenge we have, of course, in Uganda is that the Heart Institute is just in Kampala. We are trying to extend the services to the regional hospitals, so that these regional hospitals have the skill to identify the sick children and so on. Now, after identification, which is the most important part of all this, all those who have the resources to move to Kampala, they will be referred, okay? And so when they are referred, of course, they come to the Uganda Heart Institute, or they go to regional referral centers where they will also refer them to Heart Institute. And then those we manage to get at the Uganda Heart Institute, we will work on them. The truth of the matter is we are unable to capture every sick child in Uganda with the heart disease because our surveillance system is still poor. Of course, we have no better coverage for every place in Uganda, but those whom we manage to get our hands on, like in these outreach programs we do, we screen patients, we identify them, and we refer them. Because we are unable to identify
specialist centers. But I believe in the future, as things get better, eventually those regional hospitals would also become small heart institutes.
Actually, the plan for Heart Institute
that would be the
mandate. You know, right now we have the mandate. The mandate of Uganda Heart Institute is to ensure that every individual in Uganda receives cardiac services if they need them.
Receives the heart services.
Yes. Okay. And therefore, it means that we as Heart Institute, we are going to ensure that with our mandate, we establish all these centers of excellence in different areas of the country. And that way, every Ugandan will have the chance to access this service.
And we're actually already having some in Gulu, in Lira, and Mbarara. Those are already centers for heart diseases. And of course, step by step. And of course, there is even an easier method that has come up. Of course, it's not yet so much public. We are even doing certain echoes. For instance, in Gulu, they check the heart and then they post them through some kind of internet system. And we have our doctors at the Heart Institute who read those echo images. And then and so you report on the heart disease and even treat the patient online. So that's the kind of what we call a telemedicine. And if that could go on to the rest of the regional centers, then that makes life a little more.
How do you prevent your child from getting heart problems? Or if you're expecting a baby, how do you prevent that baby from being born with some of his congenital problems? So don't go away.
You are watching the DocTalk Show.